Hi guys, so I hope you guys had a look at that and just briefly talking about the a little bit what's going on there with the hypothalamus there and the front and back pituitary, but we'll continue on for sure. The two parts there to the pituitary, you'll see there's your anterior, the biggest lobe of the two, also called the adenohypophysis, controlled by releasing hormones of the hypothalamus. So you got the hypothalamus up here, okay, and if it needs hormones there released from here, it'll release hormones to here, telling this one, telling the anterior pituitary which hormones to then release, and those will go to the target hormone, which will then release another hormone. So in order to get something done, you've got a hormone, one hormone, another hormone, and then another hormone there. The posterior pituitary is quite different. You'll see there that we have nervous tissue, okay, going on there, all right? And you'll see we call this there the neurohypophysis. This is the backside there. And the nerve impulses there from the hypothalamus stimulate the nerve endings in the posterior pituitary gland to release hormones. There are lots of different hormones kicking around in the front, but in the back, okay, there's only two. Okay, there's vasopressin, okay, which is also called ADH, antidiuretic hormone. There is also oxytocin. That's it. So this is basically a storage tank for two different hormones controlled by the nervous system extension there of the hypothalamus. The anterior pituitary, you'll see there that hormones are released and then they travel down and they cause hormones to be released from here. We'll get more into that as we go. So just another shot of just kind of a close-up here. I'm not really saying anything new or anything, but you'll see there the anterior pituitary. Okay, there's your hypothalamus. Okay, sends releasing hormones there that come down here, and the blood capillaries there. Okay, of the hypophyseal portal system. You'll see the releasing hormones travel down here, and then causes different hormone to be released here, which then gets released into the circulation. Okay. Just a negative feedback here, and here's an example. You know, this is pretty generic, but as I said, there's three hormones that get released here when you're talking about the adenohypophysis. Okay, and you'll see there that the hypothalamus, let's say it senses a need to target a particular endocrine organ, so then it sends a releasing hormone to the anterior pituitary, which is right here. So this hypophyseal portal system there, so it releases a hormone, a releasing hormone to get to here. So there's one hormone. And then the anterior pituitary will send another hormone. This one here is going to leave the brain and go to the specific endocrine system. So there's the second hormone that gets released from here. And that hormone now is traveling around the circulatory system, and it is going for it's looking for the target cell of the particular endocrine organ, which then, once that gets activated, the endocrine organ will finally release the hormone in need, and that will go to wherever it's intended. Okay, and the whole idea there is once that happens, negative feedback loop, it turns itself off, it shuts itself off. Okay, just another shot here of what the anterior pituitary there's your posterior. Okay, there's your antidiuretic hormone, vasopressin, oxytocin. So this is the whole idea there. Nerve coming down here signals the storage tank to release either of these two here. Okay, antidiuretic hormone to keep water in to increase BP. Okay, and then you've got oxytocin there, which stimulates the uterine contraction. Okay, but you'll see what's going on here. The hypothalamus. Okay, as we said through that capillary portal system. Okay, you'll see it right here, hypophyseal portal system. You'll see what's going on, the capillaries right there, and you'll see there that there's your thyroid hormone. Thyroid and you'll see thyroid stimulating hormone, okay, adrenal glands, cortical hormones, adrenocorticotropic hormone, growth hormone. Oh, follicle stimulating hormone can be both with males and females. Luteinizing hormone for both as well. Oh, sorry. Prolactin there. Here we're talking breast enlargement, breast milk. Okay, so there's lots going on here, which eventually there's your testosterone, estrogen, progesterone there. This might make a little bit more sense here. You see, these are those releasing hormones released by the hypothalamus, okay, which then make its way to the pituitary. And then from the pituitary makes its way down to its intended endocrine. Okay, so again, 3 hormones when you're talking about the hypothalamus there to the anterior pituitary. Okay, so have a look at these. Okay, there's your growth hormone releasing hormone. Okay, somatostatin. Okay, and you'll see here we're talking about growth hormone, and you'll see the intended targets. Okay, prolactin releasing factor, prolactin releasing inhibiting hormone. Here we're talking, you'll see what's going on. Okay, thyrotropin releasing hormone. Here we're talking about the thyroid. Okay, there's your releasing hormone to the adenohypophysis, which then releases thyroid stimulating hormone, which then goes after and tells the thyroid there that we need action. Okay, corticotropic releasing hormone, adrenocorticotropic hormone, you'll see from the hypothalamus to the pituitary to the adrenal glands on top of the kidney. Okay, gonadotropic releasing hormone, okay, from the hypothalamus. We'll get these two going, luteinizing hormone and follicle stimulating hormone, which will follow up more, quite a little heavily there next class when we get into reproduction. Okay, we'll leave this one kind of until next week, but then we'll hit that one hard. Just hormones, names, and stuff. So you'll see that, I apologize for the quality of the slide. It's quite small, but if you zoom in, you can have a look, and you'll see here that these are the some of the hormones there released from the hypothalamus. Okay, these are the ones there we'll have a look at, and some of the synonyms there. You'll see luteinizing hormone, releasing hormone. Have a look at those. We might need these again. The hormones there released from the anterior pituitary. Okay, so these are the kind of the releasing hormones there that we saw earlier. Okay, these ones in here stimulating these activity there in the anterior pituitary. So just a great little list. Make a list, you'll see, and there are abbreviations. Generally, you'll see these there in slides to come. There's your thyroxine, triiodothyronine there, T3 and T4, ADH, antidiuretic hormone, oxytocin, OT. Generally there, I won't use these, but you will see these in your medical career written as these from time to time. FSH, absolutely follicle stimulating hormone. Okay, these kinds of things. Always good to know and good to have. We'll get into the pancreas as well later. We'll talk about glucagon, insulin, somatostatin, adrenal glands there, aldosterone, cortisol. Okay. Your medulla there's your epinephrine and norepinephrine, your adrenaline. Okay, your thyroid, we've spoken about these there. You guys should know calcitonin and its opposing hormone. Okay, from the parathyroid on the backside of the thyroid gland, there's your parathyroid hormone, controlling calcium, levels there in the blood. Anterior pituitary. Okay, hormones here. Okay, just going to go into a little bit of these there. Growth hormone called somatotropin. Okay, and affects the bones, cartilage, skeletal muscle. Okay, causes amino acids there to build into protein and fats to be used for energy. Converts protein to glucose, which isn't an easy thing to do, but it can be done. Exerts profound effect on growth. Okay, that's your hormone there, growth hormone there, found in the adenohypophysis. Prolactin there, also called lactogenic hormone, stimulates growth of the mammary glands. Okay, lactose, milk, sugar, should be a good one there. TRH, thyrotropin releasing hormone there from the hypothalamus, stimulates the production of thyrotropin or thyroid stimulating hormone. Where's your target? The thyroid for sure. Okay, so this is in the pituitary, which targets the thyroid gland, stimulating it there to secrete T3 and T4, which we'll get into there in a little bit. Thyroxine, this is your iodine. This is where you need it. We'll get there in a bit. Adrenocorticotropic hormone, ACTH, targets glands in the adrenal cortex, stimulates the secretion of cortisol and aldosterone. ACTH is secreted there from the anterior pituitary in response to corticotropin releasing hormone there from the hypothalamus. Okay. Gonadotropic hormone there, gonads here, we're talking about the sex cells. Follicle stimulating hormone, luteinizing hormone, targets glands at in the gonads or the sex glands, ovaries, testes. The two gonadotropins are follicle stimulating hormone and luteinizing hormone, which we will hit hard for our last class. Okay. Posterior pituitary gland, as I said, it's on the back side here, and you'll see the hypothalamus. It's basically one nerve, travels all the way down. Okay, nerve fibers originated in the hypothalamus. Okay, this is called the neurohypophysis for a reason. And there's your nerve. Two hormones, antidiuretic hormone, also called vasopressin, increases blood pressure by decreasing the urine production. Okay, you're keeping the tank full, so the tank, and you have to think your cardiovascular system is about 5 liters, right? And if you stop the release of water through urine production and you maintain that water balance within the blood, the volume of blood will increase. And therefore, if you have more water in a pipe, you have more pressure in the pipe. And that's what the kidneys want. The kidneys dictate blood pressure for sure. Oxytocin enhances uterine contraction. We can actually synthesize this synthetically. Okay, and give injections as needed. The antidiuretic hormone ADH, released to conserve reabsorb water from the urine and return it back to the blood. Primary target, definitely the kidneys. The hypothalamic cells that sense the increasing osmolarity of the blood are called osmoreceptors. ADH is released in response to concentrated blood. Okay, concentrated blood, right? It's a little thick, a little soupy. We want to water it down a bit. So this is all increased osmolarity and decreased blood volume. Both occur during dehydration. You don't want soupy blood. You want some good water in there. Absence of antidiuretic hormone results in diabetes insipidus. Absolutely. Causes blood vessels there to constrict, which elevates BP. Vasopressin is another name. Oxytocin, okay, targets the uterus and mammary glands. Nervous system sends signals via the neuroendocrine reflexes. When baby breastfeeds, oxytocin is released and stimulates contraction of smooth muscles around the mammary ducts to release milk. Okay? Good stuff. Moving on. Now, here we're on to the thyroid, okay, which you'll remember there from muscles, okay, the whole idea there that the kidneys, they need a certain BP, but these guys here, the thyroid assists in blood calcium levels, okay, and then on the back side, okay, the parathyroid also helps as well. There's your calcitonin, as you remember. But this gland here, if this one here is not working properly, nothing else in the body is working properly. Okay, so this one here is pretty important. We call it there the thermostat of the body, and I'm not talking measuring temperature. We're talking measuring wellness. Okay, it determines the rate of metabolic processes at normal size. You can't feel very, very, very vascular. Lots of blood flow into here. Produces 3 hormones. Calcitonin, as you'll remember there, lowers blood calcium, gets that calcium there onto the blood, onto the bones. It also makes T3 and T4. And T4, thyroxine, which you have more of, and then you have T3, which is triiodothyronine. It's a more potent version of T4. Okay. So there's your So here we've got your T3 triiodothyronine and T4. Just call it thyroxine. If you want to say that, go for it. Iodine essential there for the synthesis of these two. Okay, iodine deficiency causes goiter and enlargement of the thyroid gland. I have an interesting shot of this. The whole idea there, if you do not get enough iodine, what happens there? Thyroid starts producing, tries to produce, overproduce, but it's not producing anything, and it develops this enlargement there under the in the throat area. I'll show you that there later. So iodine deficiency interferes with the negative feedback loops. Absolutely. So what the thyroid hormones do, you've got T3 and T4. They regulate metabolism. Absolutely. Permit proper functioning of all other hormones. Promote normal maturation of the nervous system. Promote normal growth and development. Hey, that doesn't sound like a lot, eh? This tiny little endocrine gland, if this one here is out of whack, the entire body is out of whack. Okay. We've got calcitonin here, helps regulate blood levels of calcium and phosphate, stimulates osteoblastic activity in the bones, increases excretion of calcium and phosphates in the urine for sure. Looking into the T3 and T4, okay, these guys here are secreted there by these follicular cells. You'll see these follicular cells here. You've got these little ones here on the outside called parafollicular cells. These ones here secrete calcitonin. Okay, here we're talking about the thyroid itself. Okay, you got these colloid cells as well. Follicle stimulating hormone releases T3 and T4 into the blood. And you'll see there the parafollicular cells. These are the ones there that produce the calcitonin. Okay. Just a nice little shot here, more detail there of what the thyroid hormones do. So if you had a chance there to watch the movie there, you'll see that T4 and T3 are both secreted. Okay, you got more T4. Okay, and you'll see that this movie is kind of similar to one of the hormone movies there we showed there before. Both of these there, they enter the cell, but all of it there gets converted into T3, which is 5 times more potent than the T4 thyroxine. Okay, and yeah, have a look at the movie there. It's really great. Okay, it shows you there how the hormone is lipophilic and just goes right through, and you end up making the proteins there that the cell needs. There's your calcitonin, lowers the blood calcium level. You have a look at those. Opposing hormone there is parathyroid. Okay. Abnormal thyroid secretions, you've got hypothyroidism and hyper. Okay, so hypo, deficiency of T3, T4 results in a slowed down metabolic rate. Okay, hyper, too much T3, T4 causes accelerated metabolic rate, or what we call Graves' disease. And here are some shots here. You can have a look. The hyperthyroidism, you see the enlargement there of the eyes. And then here, low, you have the goiter. Okay, where the thyroid is overproducing fluid, thinking it's trying to produce some T3, T4, but it can't. It doesn't have enough iodine. Okay. Control of T3 and T4, and you'll remember there that thyrotropin releasing hormone there from the hypothalamus then goes to the pituitary, which then releases their thyroid stimulating hormone, which then travels to the thyroid. Okay. So you've got thyroid releasing hormone, okay, from the hypothalamus, thyroid stimulating hormone, then to the thyroid, T3 and T4 are produced, and then the more T3 and T4 that are produced ends up turning the whole system off. Okay, great little way there to have a look at it. I love these little diagrams here. You guys remember the parathyroid hormone. Now we're on the posterior side of the thyroid. These 4 little P's. Okay, these are your parathyroid glands. There are typically 4 of them, and it only secretes one hormone, as you remember, parathyroid hormone. Okay, and when the blood calcium gets low, this is released, and they start robbing the bones of calcium and phosphate and dumping them back into the blood, right? And that's what's going on here. Exactly what's going on. Okay, have a read of that. Pause it as you need to. Everything looks to be in good shape. More in the parathyroid here. There's three mechanisms there. There's bone reabsorption. Okay. There's kidneys reabsorb calcium there from the urine. Okay. And the intestines there, they absorb dietary. So we don't let that calcium go. When low blood calcium is situation there, we rob the bones. Okay. We tell the kidneys there to reabsorb calcium. And we also tell the intestines as well. Get that blood calcium back up. And there we go. Okay. Just another shot of the same thing, kind of. You'll see increased levels of PTH going to the bones, getting calcium, robbing the bones, getting it back into the bloodstream. PTH also talks to the kidneys. Hey, we need to conserve calcium. Don't let it go. And the kidneys do their job. The same thing there with vitamin D. You'll see that the calcium there is removed from the food in higher amounts. And the increased calcium will turn this whole thing off. Okay, great little, and if you didn't like that one, here's the same thing here, but here we're talking about calcitonin and your parathyroid hormone here. Opposing forces, okay, when the blood calcium gets too low, there's your calcium. There's your calcitonin, which increases the blood level of calcium, but when that starts to get too high, okay, when the blood calcium gets too high, that's what the calcitonin is there to do, to remove it. And then when the blood calcium gets too low, there's your parathyroid there, which indicates there to these three guys, get busy, and we need more calcium in the blood. Okay. Parathyroid glands, abnormal secretions. Again, we have hypo and hyper. Okay. Low. Okay. Hypocalcemic. Tetany. Causes carpal spasms, and here we're talking hypersecretion, hypercalcemia, bones, stones, moans, and groans. Too much calcium in the joints, and you'll see what it does. It just locks those joints up. So you can have low calcium or too much. Moving on to the adrenal glands here, we're just on top of the kidneys. Okay. They are closely associated with the kidneys. They're in a good spot, okay, and they sit like a cap on top of each kidney. The hormones are secreted from two different areas of the gland. You have the adrenal cortex, which is the outside of this. This is the cap there that sits on top, so we're having a look up here and we're blowing it up. So there's your cortex, which is on the outside, and then you have the medulla, that brown area in the middle there. Numerous hormones are secreted there by these guys. Okay? And you can even reference there the whole idea, the connective tissue on the top. Okay? But then you have the different zones associated. Okay? And you'll see there's your cortex and then down into your medulla as well. Extension of the sympathetic nervous system. Fight or flight. You will remember there that you have the sympathetic and parasympathetic. Sympathetic nervous system, we all have the ability to be a Hulk, a superhero. Okay? When our lives are in danger, the body will go to extremes to survive, and that's what this one is. The opposite end, you remember there, is the parasympathetic, the rest and digest. Okay? When our lives are not in danger, we're able there to digest a sandwich, go to the bathroom, relax, sleep. Okay, so but the adrenal medulla here, we're talking an extension of the sympathetic nervous system. Okay, this is what you're looking at here. So fight or flight increases heart rate and blood pressure, mobilizes body there for emergencies. How does it do that? Catecholamines here. We've got epinephrine and norepinephrine. Okay, and here the hormones there of the adrenal cortex. Okay, these are of the medulla. So you'll see medulla on the inside, epinephrine, norepinephrine. Okay, the cortex, though, you'll see there's aldosterone, cortisol. These are the two there I want you there to know. Well, we'll get into the aldosterone system there later on. I have a couple of good slides of that one. Helps regulate the concentration of extracellular electrolytes by conserving sodium ions and excreting potassium ions. So generally a rule, wherever sodium goes, so will water. So if you're conserving sodium, you're keeping sodium in, what you're really doing is keeping water in. Okay, so there's a lot of relationship here based on antidiuretic hormone, which we'll get into. If you keep water in, you're going to maintain a high water level within the blood, so it means you're going to be have a higher BP. Okay, electrolyte concentration in bodily fluids, renin-angiotensin mechanism. We'll get into that right there. Okay, as well, another hormone there I want you to know: cortisol decreases protein synthesis, increases fatty acid release, and stimulates glucose synthesis there from non-carbohydrates. Kind of relaxes you here. Okay. And adrenocorticotropic hormone there from the anterior pituitary. You guys can have a look at that there. Going back into the medulla, you'll see there that the sympathetic nervous system, epinephrine 80%, norepinephrine 20%, functions as part of the cardiovascular system. At the same time, a stress message goes to the heart, a short-term message. The same message goes to the medulla to maintain a longer period of fight or flight. Basically, what you're talking about here is a backup system. And you guys can have a look at these there. There's your epinephrine, norepinephrine there. You can see the differences involved. Okay? And their effects on the different areas. There's your heart, blood vessels, systemic blood pressure, which is body. Okay? Airways, reticular formation of the brain, liver, metabolic rate there, and you'll see what goes on. Okay, good stuff. You may need that later. Adrenal cortex. Okay, here we're talking about steroids here, and you'll see the whole idea. Hypothalamus releases a releasing hormone there to the anterior pituitary, which then releases adrenocorticotropic hormone, which then stimulates their cortisol release. Okay, and the whole idea here with sugar, you got glucocorticoids. Now you're talking cortisol, which is most important. Okay, just going back into cortisol, decreases protein synthesis, increases fatty acid release, and stimulates glucose synthesis from non-carbohydrates. That's what's going on with cortisol. So you'll see what's going on. Salt there, you got mineral corticoids there. There's your aldosterone and sex hormones, testosterone most important, okay, at this juncture for now. And you'll see the negative feedback loop of what's going on. You'll see, and more of this turns the whole system off. Okay. Glucocorticoids, they affect carbohydrates. They convert amino acids into glucose, which isn't an easy process, but it needs to happen sometimes. Gluconeogenesis, and helps maintain blood glucose levels between meals. Affect protein and fat metabolism, burning both substances as fuel to increase energy production. Okay. Mineral corticoids, sex hormones. The chief mineral corticoid is aldosterone, which plays an important role in the regulation of blood volume, blood pressure, and the concentration of electrolytes. Absolutely. The primary target organ of aldosterone is the kidney. Okay, stimulates the kidney's reabsorption of salt, which means the reabsorption of water by excretion of potassium. Sex hormones, female estrogen, male androgens, testosterone. Abnormal secretions of steroid hormones. You've got hyposecretion, Addison's disease, acute adrenal cortical insufficiency. Love it. Hypersecretions, you've got Cushing syndrome there. Okay, have a read of those, and we'll see you on test day. The pancreas, this is a dual functioning organ here. It's both endocrine and exocrine. Okay, now you remember there, endocrine, no gland, no duct. Exocrine has a duct. So you see the pancreas has two major types of secretory tissue. Okay, three hormones there that I'm interested. Okay, secreted there from the islets of Langerhans. This is just a type of cell. There are alpha cells, release glucagon, beta cells, insulin, delta cells, somatostatin. Okay, there's your carbohydrate regulation. Pause the movie and have a look there. You'll see, have the diagram there. There's your islets of Langerhans. Okay, these guys here, and yeah, good little. And let's pause it up here and have a look at the movie. Okay, hopefully there you guys had a chance there to watch the movie there and get caught up. You'll see there that glucagon and insulin, these two are kind of opposing. While blood glucose levels will get high, the body, the pancreas will produce insulin, which lowers the blood glucose level. But then when the blood glucose level gets too low, you get a little dizzy, the glucagon there stimulates the production or dumping of glucose back into the blood. Okay, gluconeogenesis, producing carbohydrates there from non-carbohydrate sources. These kinds of things, breaking down fats. Good stuff. And then we got somatostatin there, helps regulate carbohydrates. Okay. Great little shot here detailing what's going on, the whole opposing forces there when you have high blood glucose. Okay, high blood glucose. All right, you probably want to go there to your insulin, and then you'll see there when you have low blood glucose there, you want to go to your alpha cells there. These guys here produce glucagon, which increases the blood glucose levels. Okay, beautiful little slide there. Just more on the same thing when you're talking about type 1 and type 2 diabetes. Blood glucose levels rise, pancreas secretes insulin. Blood glucose levels fall, pancreas secretes glucagon. Get that sugar back up, right? And type 1 diabetes, this is exhibited there in children, usually around maybe 8 to 10 years old when they start eating sugar and they start to feel really sick because their bodies do not produce insulin. Okay, so these individuals there, they need to get a shot. Okay, they need that insulin input into their body so that they can reduce the amount of sugar in their blood because they don't produce insulin. Type 2 diabetes, though, is exhibited in older adults who tend to have not eaten had the healthiest of lifestyle. And you see, over many years of abnormally jacking up your blood glucose level by having a Coca-Cola or not eating healthy. So what happens there? Pancreas produces insulin. All the body cells open up and all the blood sugar goes into the cells. Well, you do this for 20, 30 years and your body's still producing insulin, but the cells don't respond anymore. So these guys here, type 2, we actually call insulin resistant. The cells don't open up anymore, so you can't get rid of that high blood glucose level, and that can be dangerous. Good movie here. Pause it, have a look, and we'll see you on the next slide. Thank you very much. Glucagon here, pancreatic hormone secreted there by the alpha cells of the islets of Langerhans. Primary actions to increase blood glucose levels. How does glucagon raise the blood glucose levels? By stimulating the conversion of glycogen to glucose in the liver and by stimulating the conversion of proteins into glucose. Gluconeogenesis. Love that word. You might see that again. Hint, hint. Diabetic people with an infection always have difficulty in controlling their blood glucose level. They require frequent blood glucose monitoring and additional insulin. Yeah, it's a tough one. It really is. Okay. Insulin deficiencies or ineffectiveness, hyperglycemia, excess sugar in the blood, glucosuria, sugar in the urine, which you should never see, polyuria, excess urine production, polydipsia, excess thirst, polyphagia, excess eating, acidosis, like the whole idea there that the blood is the blood pH is around 7.35. And it does not venture very far from that. So if that drops just a tiny fraction, now you're into acidosis, excess of acid in the blood, okay, because the cells cannot burn glucose as fuel, they start burning fatty acids instead, which cause the increase in acid. Okay. Fruity odor in the breath, acetone. Acetone there, that is found in nail polish. It's got that particularly organic smell, and that's what goes on there with the rapid fatty acid catabolism. Okay, breaking down these guys. Okay, when that's all you can. Lifespan changes. We've got the endocrine glands tend to decrease in size. Okay, especially with the thyroid. The thyroid as a child is pretty big because you have to think when a baby's born and you give them a bottle, you have to disinfect. You have to steam sterilize that bottle because these kids, newborn babies, don't have an immunity, right? But as we acquire immunity throughout the course of our life, the thyroid does shrink, as do most of these. Muscular strength decreases as growth hormone levels decrease. Antidiuretic hormone levels increase due to slower breakdown in the liver and the kidneys. Calcitonin levels decrease, okay, increasing the risk of osteoporosis. Interesting one, okay. Parathyroid level changes contribute to the risk of osteoporosis. See, as you're young, you want more calcitonin than parathyroid. Calcitonin, osteoblasts, building bone. Parathyroid, osteoclast, degrading bone. But as you get older, this tends to be more prevalent than calcitonin, right? It makes the bones weaker. Changes in melatonin secretion affects the body clock. Thymosin production declines, increasing the risk of infections. Other glands to take note. As I said, we'll cover the gonads there next week when our last class, testes and ovaries. There's the thymus. Wish we had more time. That's a good one. Secretes thymosins, affects immune function. Pineal gland. I always ask a question on that. When there's your biological clock. Okay? These are some great movies here. Have a look. Aldosterone. Have a look at that one. You will see that one again. Watch all of these movies. They're all good to go. Any questions? Let me know. Shoot me an email. And there's another movie, Endocrine System in a Nutshell. Thank you very much. Have a wonderful day. And we'll see you there for our last class soon.